John Ameh and Baiyewu, the deputy chairman of the Senate Committee on Media and Public Affairs, Senator Ben Murray Bruce, has stressed the need for presidential and governorship candidates to make their medical records public before their election into office. Murray Bruce, in an interview with one of our correspondents on Saturday, argued that such arrangement was being practiced in the United States, from where Nigeria borrowed its democracy. The senator said although there was no existing law that made the publication compulsory, such candidates had the moral duty to make their health condition known to the electorate. He said, "It is not just about medical fitness, we are looking at a bill to make sure that all candidates publish their medical records and let the nation know the level of their medical fitness. In America, you will publish your medical records. Your doctor will tell the people if you have any illnesses that could impair your ability to work at any level." But members of the House of Representatives expressed opposing views on whether it is appropriate to compel persons seeking political offices to disclose their health status by law. The chairman, House Committee on Financial Crimes, Mr. Kayode Oladele, said making the health status of presidential and governorship candidates public would amount to an invasion of their privacy. Besides, Oladele, a lawyer, told Sunday Punch that the nation's constitution already made adequate provisions for how the failing health of an officeholder could be addressed. He said, "People have their right to privacy. The fact that they want to contest election does not mean that they should make their health status a public issue. It will be an infringement on their right to privacy. The Constitution has already addressed it by making provisions for anyone in office who has become incapacitated on the grounds of ill health or infirmity, to give way. There is nowhere in the world that you are required to disclose your health status as a precondition for contesting an election. The international best practice is that there is right to privacy." However, the chairman, House Committee on Justice, Mr. Rizak Atenwa, told Sunday Punch that disclosure was necessary as a matter of morality. Atenwa, who is also a lawyer, noted that legislating on the issue might appear draconian, but added that it was still necessary to disclose the health information of public officeholders. He said a time would come when the electorate would, on their own, begin to demand that the health status of office seekers be made public. He said, "It is not a question of being a legal issue. It is a moral issue. In my view, the electorate needs to have as much information about a candidate as possible for them to be able to decide whether that person is fit for office." Another member, Mr. Karimi Sunday, said Nigeria's democracy was not ripe to have such a law in place. Sunday observed that such law was not in place in advanced democracies like the United States and the United Kingdom. Another member, who spoke on condition of anonymity, also argued that making the health status of presidential and governorship candidates public would be useless because health was a matter reserved for God to determine. He said, "If you know your health status before contesting an election, what happens during or after the election? Someone may be certified fit today and the next moment, he is struck by an ailment. It's a delicate issue, really." Another member, who also spoke on condition of anonymity, noted that since Nigerians could be very smart at falsifying documents, publishing health status might not achieve the desired result. People have contested elections with forged certificates before in this country. Is it the health status that will not be forged, the member stated. Copyright Punch. All rights reserved. This material, and other digital content on this website, may not be reproduced, published, broadcast, rewritten or redistributed in whole or in part without prior express written permission from Punch. Contact via email. Protected. Visited 824 times, 30 visits today.